Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Mike Farrell here with you, and we're ready for Doctor's House Call. Remember, give us a call if you have any questions, medical questions. You wonder why, this isn't working or that isn't working and what you can do about it. Well, the doctors are here for you, Dr. Gear, Dr. Wyrick, and all you have to do is call 474-2427. If you're out of state or out of country, call 928-474-2427. And here we go. Good evening, Dr. Gear.
Hello, Mike, and hello, everybody out there in Radio Land.
Good evening, Dr. Wyrick.
Good evening.
How y'all doing?
We're doing great.
Good.
You know, Dr. Wyrick has done a fantastic job putting together this program that we're going to give you today. It is a very scientific program, but it's written in plain language. And if it's not plain language, give us a call and tell us what you need to know about.
You know, the topic, cognitive decline and brain function, the anti-aging made easy for you. This is the big worry of most people I've read in surveys about getting old. They're more worried about, getting dementia, Alzheimer's, that type of thing, than anything else. They don't want to spend the last years of their life
That's right.
with that kind of a problem. So, you have an answer to that?
We do. Today we're going to continue our theme of anti-aging. We're going to talk about the problem of cognitive decline due to diseases such as Alzheimer's disease, Dr. Wyrick disease. I didn't know. So, Dr. Wyrick, you're board certified as a health practitioner diplomat in the clinical science of anti-aging. What in the world does all that mean?
Well, that means that I have engaged in advanced study of factors that affect aging and have learned ways to slow down and in some cases cause signs of aging to regress or reverse themselves. I then took and passed a written exam given by the American Board of Anti-Aging Health Practitioners with the alphabet soup ABAAHP as the acronym that I'm privileged to put after my name now as a professional.
Oh, hallelujah. Those are some big words.
Yes, I'm more than just piled higher and deeper.
What does it mean in simple, everyday language?
Aging is what happens when we get older. Duh. We slowly lose our youth, become weaker in mind and body, and eventually die. Well, this happens faster for some people than others. In some cases, people live to over 100 years old and still retain a keen mind and a serviceable body. Others suffer from a much faster aging process. Anti-aging is the field of medicine that aims to slow down that aging process to help keep a serviceable body and mind longer. So today I want to talk about slowing the aging of the mind and what used to be called getting senile, but is now mostly associated with Alzheimer's disease.
So aging is normal, Dr. Wyrick. What do you mean you want to fight aging?
Well, we'll have to define what the meaning of normal is, but some factors that affect aging are controllable and some are not. Anti-aging medicine focuses on what we can control in order to slow down the aging process. For example, we have recently talked about environmental factors such as stress and epigenetics, which is various interventions that we can do to modify gene activity on this show. But what is normal? Do we want to settle for normal, or do we want optimal?
Dr. Wyrick, you use big words. I looked it up. Center for Disease Control says epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work.
Yes, and Implied in that is we use that knowledge to actually control our genes.
Yeah, so unlike genetic changes, epigenetic changes are reversible, according to the Center for Disease Control, and do not change your DNA sequence, but they can change how your body reads a DNA sequence. So what do you mean by all that? You started to tell me and I interrupted you.
Well, it basically means that every gene in our body tells our body how to make some protein in the body. And depending on various controls that are put on that gene can either express itself a lot, that is, can make a lot of protein, or it can be relatively turned off and not make much of that protein. And so the different balances of proteins in the body affects our overall health.
So in scientific terms, what does normal mean?
Well, thank you. Normal means middle of the bell curve, which means half the people live longer than normal and half the people live shorter than normal. So I like to look at normal as being like getting a C in school. The average life expectancy in the United States, according to the CDC, is 78.6 years.
The CDC, that's Center for Disease Control?
Yes, it is.
Okay.
That is normal. Optimal is like getting an A. I want to help my patients get an A by slowing down aging of mind and body as much as possible.
Yeah, but who wants to be old and decrepit by living longer? Because that's what happens, you know.
Well, no, that's my point. Nobody wants to be decrepit. Sooner or later, everyone becomes decrepit if they don't get hit by a truck or something first. But at what age do they become decrepit? My ideal is to live life fully with a healthy mind and body of like a 35-year-old and do that for 100 years. And then to become decrepit on my 100th birthday and die of old age the next day. So that's a little bit of optimistic hyperbole, but you get my point?
You know, I'm still here on this earth, so I guess that means I'm above normal, because I'm past that magical C number. What year was it, 78.6?
Yes.
Yeah, I beat that already. So let's change the subject, though. Let's talk about the problem of mental decline. How big of a problem is this?
Well, according to published reports in PubMed, which is the official medical library of the United States, cognitive decline is becoming a bigger problem as medical science keeps our bodies alive longer and longer. I won't cite all of the published sources of this on the radio because that just doesn't make for good radio. But my website, which is drweyrich.com, has links to the original papers. For the purposes of talk radio, I will simply say that most of my information that I will share today comes from a paper by Dale Bredesen entitled Reversal of Cognitive Decline, a Novel Therapeutic Approach.
So, Dr. Weyrich, is cognitive decline the same as Alzheimer's disease?
Not exactly. Cognitive decline is a more general term that refers to any loss of mental sharpness. There are a number of different causes of cognitive decline. Alzheimer's disease is one of the most common causes, and probably the most feared.
For our listeners' sake here, if you just tuned in for the first time, Dr. Weyrich is a PhD in organic chemistry, as well as a naturopathic medical doctor with full education in medicine, and he's a specialist in anti-aging. He's specializing in internal medicine and endocrine disorders, that's hormone therapy. He's got a pretty good brain on him for all these chemical things that go on with the body, and he knows how to make all those testings work and then figure out what's really going on in your body, so it's not just a knee-jerk reaction. This is the symptom, this is the drug. We don't practice that way over at Payson Health and Wellness Center. We want to know what's causing the problem and how do we fix that before it gets to the point where you've got to cut something out or where you've got to go in twice a day for intravenous therapy or all kinds of other problems of that nature. We want to stop you from having to do those kinds of medicine and get into how to make real good health care. So, Dr. Wyrick, why is cognitive decline feared?
Well, I think we have a caller. Let's take the call first.
Hello, caller. You're on the air. How can we help you?
Sorry, that was a butt dial.
Oh, okay.
Okay. So why is Alzheimer's disease feared? Well, one study shows that today a woman is more likely to die of Alzheimer's disease than she is of breast cancer. And that's a very scary disease for most women.
Well, wait a minute, Dr. Wyrick. Breast cancer, women are scared to death of that, and I don't blame them. But you mean Alzheimer's disease
It's more dangerous.
is more dangerous?
Yes.
More women develop that than they do breast cancer?
Well, at least die with Alzheimer's as opposed to dying due to the sequelae of breast cancer.
So is there a mammogram for the brain function?
We'll talk about that, but not a real good one.
Okay. Go ahead. I'm sorry for interrupting you.
Okay. So anyway, some estimates have shown that Alzheimer's disease is now the third leading cause of death in the United States, behind cardiovascular disease and cancer. Because a person suffering from Alzheimer's disease can live a long time without the ability to care for themselves, their Alzheimer's disease puts considerable stress on caregivers and financial resources. But I'm happy to say there is now new hope from some cutting-edge case studies that I will share with the radio audience today.
So I'm going to say to you, when I was a little boy, it was said to me that Eskimos were reported to have put the old person who could no longer do their part in the family unit out on the ice to either freeze to death and or be eaten by a polar bear. So how does someone know if they or a loved one has Alzheimer's disease and was ready for the ice for the polar bear?
Well, it's not just Eskimos. There are many ethnic groups where, in many cases, an elder person who is in decline will just voluntarily leave the group and go off to die, and I think elephants do the same thing as well.
But we still have humans that stop eating,
Yes, yes,
and they just pass on.
yes. But how do we know? Well, from the point of view of when it's time to be put out to pasture, you don't need a diagnosis of Alzheimer's. You just decide that you are no longer able to do what you feel you should do to contribute.
Well, is there any tests that we can do to show this?
Well, if you're talking specifically about Alzheimer's, there are a number of tests that can be done, but they're not 100% certain. The only 100% certain diagnosis of Alzheimer's disease is by autopsy, which is a little bit too late for any decision making.
I would say so.
There are some expensive tests like the PET scan, which is positron emission tomography.
That's an X-ray type?
It's a radioactive study that is similar to a CAT scan in its data collection, but it's not using X-rays. It's using radioactive particles that are emitted by the body.
Right. That's a very significant type of diagnostic imaging that we have available to us now.
Yes, and specifically it can show us the metabolic activity, how much our brain is actually working.
Yeah, it shows up. I think that most of it's is sugar functioning
Yes.
in various parts of the brain. When you think certain thoughts, part of your brain will show up fluorescing, so to speak, with the positive
Positrons.
positron emission tomography. And then you think another thought, and another part of the brain will lighten up, and it's kind of interesting, isn't it?
If I were a straight-out neurologist, I would just be loving this. But it costs about $5,000 to order the study, and insurance doesn't normally pay for it if all we're looking for is to diagnose Alzheimer's.
You know, for $5,000, we can take a person and move them a long way toward health, can't we?
Right, and we don't have to ask the question of what their PET scan is.
Right.
And MRI is also very useful. But again, that's a $5,000 study, and insurance isn't going to pay for it.
Well, the MRI can be done for maybe $300, but that's just the study itself, and it doesn't show the action of the brain. It just shows whether the brain is shrunk or not.
Yes, which is useful information.
Yes, it is, but it still is static information, not functional information.
Yes.
There's people that have a half a brain that still work normal. So.
Oh, yes. There have been case studies of somebody who had a railroad spike driven through his brain, and he recovered from that very serious injury.
Right. So there's a lot of things like that in neurological research that we've studied in the past. So are there less expensive tests that we can order?
Oh, yes. There's a number of tests that we can order at Patient Health and Wellness that give some insight into the various risk factors and which will suggest certain therapeutic treatments. But these tests do not give a definitive diagnosis of Alzheimer's disease. They simply say these are metabolic problems in the body that can contribute to mental decline.
So if we don't know how to specifically treat Alzheimer's disease, how can we hope to treat it?
Well, we have a number of different theories about what causes Alzheimer's disease and other cognitive decline. And these theories have support in various laboratory studies. Following each of these different...
Wait. So the theory is not pie in the sky theory. It's something that has some science behind it to back up how the theory was developed and how it's made and how it can be followed.
Yes. The problem with a lot of science is causation is not correlation is not the same thing as causation, or association is not the same thing as causation. So that means that just because when we see A happen, we then see B happen, that doesn't prove that A caused B. So these theories suggest that this thing that we observe in the test is associated with the result of mental decline.
That sounds like an awful lot of double talk to me.
It is. And
why don't you just come right straight out and say, we got some tests that give us a pointer, and we can look at it in the individual person and see if that's what really works for them by applying it, and see if there's a change made. And we can do that in a short time, usually within just a couple of weeks.
Yes, we can. That is called a therapeutic trial that is based on an intelligent extrapolation of the theory and the previous research studies findings.
So there's some theories about drug therapies, drug treatments that help in some animals and humans?
Well, not just drugs, lifestyle interventions. There's also theories about how those can benefit anti-aging in general and benefit slowing down cognitive decline in particular.
Well, I know that works so well with all my patients that I've worked with over the years. There's some phenomenal changes that have taken place in people when they are able to get the blood flow restored to the brain, and when they're able to get rid of all the foods that cause them inflammation in their intestinal tract and block the absorption of nutrition. Just those two things alone make a world of difference.
But following each of these different theories suggests various drug and lifestyle treatments that seem to help in some animal or human studies. But none of these treatments by themselves have been shown to be particularly effective in human trials. They have a measurable benefit, but it's nothing to write home about in many cases. There are several FDA-approved pharmaceutical drugs, but none of them do much more than delay progression by a few months.
Well, that sure is a lot different than what we realize by doing the things I just mentioned a few minutes ago.
Yes. So recently, an article was published in the New York Post and a number of other news sources as well, talking about a new drug called aducanumab. Say that 20 times.
Boy, that's a tongue twister.
Yeah, the MAB at the end means that it's a monoclonal antibody, which is the latest, most expensive kind of drugs that are being developed. And it's being considered for approval by the FDA. Only one clinical trial really showed that it was useful, And it was on about 1,650 people. And there was a statistically significant benefit of slowing mental decline by, get this, 0.39 points on a 18-point mental status scale. By my calculation, that's a benefit of about 2% in slowing down the rate of decline. And that's not really, while it's statistically significant, it's not of great clinical significance, especially because it's estimated the drug, if approved, will cost about $3,500 a month.
Holy cow, that doesn't sound very hopeful to me. I get the impression you have a better idea. Is that right?
Oh, absolutely. The problem with aducanumab and the several other Alzheimer's disease pharmaceutical drugs on the market today is they all assume that there is a single underlying cause of Alzheimer's disease and therefore a single approach to treating Alzheimer's disease. Instead, the study that I'm going to talk with the radio audience about today took a different approach and assumed that Alzheimer's disease is, in theory, the result of a number of different disease processes that all combine to produce what we call Alzheimer's disease. Each of these theories points to a different treatment and has, like the pharmaceutical drugs, only limited benefit for each one of those theories. But the big difference is that by combining a list of a number of standard naturopathic treatment protocols that are suggested by the different theoretical disease processes, the combined effect can be dramatic.
So you say naturopathic treatment protocols. That's a naturopathic medicine? What does that mean?
Well, it means the kind of treatments that naturopathic medical doctors licensed as physicians in Arizona are trained to deliver. That means you and I, Dr. Gear and Dr. Wyrick, are trained and licensed to deliver these treatments.
So how about some examples, Dr. Wyrick?
Okay, let me share with the listening audience one of the case studies that Dr. Bredesen, who's an MD, published. A 67-year-old woman had a job that required her to prepare analytical reports and to travel a lot. I'm shortening the story for the radio. Her cognitive thinking processes declined to the point that she could no longer do her job. She got lost traveling in familiar places and would mix up the names of her pets and forgot where the light switches were in her own house.
You know, a number of years ago, when I was under a lot of stress, this is like, almost 30 years ago now, I would walk into a room and I couldn't figure out whether to turn on the light or not turn on the light or whatever was happening. And a chiropractic doctor, educator that I knew told me, why don't you try this omega-3? So I took about 6 times the normal amount of omega-3, and within 2 months, I was so much better. Within 3 months, I was all back to normal again, and so I quit taking it. Stupid me. Within just a few months, I was back to what I was before. So I started taking it again. And then I got better in a short time, but I stopped taking it again. You know, you got to hit me in the head with a 2-by-4 about 10 times. And so I started taking it again, and this time I stayed with it, and I've stayed with it ever since. And I don't have that problem at all anymore, never have had since that time. It's been 30 years, but I've been taking this omega-3. So what do you think about all that, Dr. Wyrick?
Well, that's a classic example of a crossover study. And yes, omega-3s are on the list of interventions for cognitive decline.
They certainly work good on the brain, I'll tell you for sure. And I've used that with lots of my patients and had very good success.
Yes, I recommend it for all people with cognitive problems.
And I use the applied kinesiology muscle testing to see whether or not it's right for that individual with their electromagnetic energy field and see if it makes it better or not before we prescribe it for them, because there's several different ones that are available from different companies. So you kind of have to work with each person to see which one of these products is going to work for them and how much of it and when to take it during the day and night. So it's pretty important to do all that testing individually with each person.
So let's get back to our case study. After 3 months of treatment by Dr. Bredesen, all the problems I just described were resolved, and she became asymptomatic. That means she had no symptoms of mental decline. She said that her memory was better than it had been in many years. 2.5 years later, at age 70, she was still asymptomatic and continued to work full-time.
Wow, that's pretty impressive. Are you saying that she was cured?
Oh, no. We can't claim to cure diseases that the MDs say are incurable. But what I will say is that she apparently somehow attained a remission that has brought her, I don't know how many extra years of mental acuity. So skeptics might say that this was what, quote, a spontaneous remission that science can't explain, meaning it just happened. Maybe it's a miracle. As a licensed physician, I cannot claim cures of a disease that the medical establishment states are incurable. But I can say that it is an interesting application of a number of naturopathic treatments that each has the potential benefits that are accepted in the naturopathic medical profession. And another thing that skeptics might do is they might dismiss this as an anecdotal evidence that lacks the scientific validity of what the medical establishment calls placebo-controlled, double-blind, randomized studies.
Well, what does that mean, Dr. Wyrick?
Well, I don't think that our listeners want to know the details of how that is done, but the main point is that they are very expensive to do, which is why the possibly new pharmaceutical drug, aducanumab, is expected to cost about $3,500 a month.
And it only slows the rate of progression by about 2%? How can that be?
Well, the FDA requires that a potential new drug be proven with 95% certainty, statistically, to be more effective than placebo, that is, a sugar pill. If the benefit of the drug is very small, like 2%, it takes a very large study to get enough statistical power to prove that this is different from just a random event. If the drug is highly effective, it only takes a very small, much cheaper study to statistically prove that the drug works.
Now, how can we rely on an anecdotal study, case study, that doesn't have this statistical proof?
Well, just because it's anecdotal and wasn't done in the formal method that the medical profession, allopathic medical profession prefers, doesn't mean that it's not evidence. It is evidence that is of a weaker nature. But here's the thing. In this study of 10 patients, we had a much better than a 2% response rate. And so even though we lack controls, we have such a powerful response that it doesn't take a very large study to raise our eyebrows. So Dr. Bredesen did not report one case study. He reported 10 case studies. And get this, all but one of these 10 cases showed clinically significant benefits. In 6 of the cases, patients who had been forced to quit their jobs or were having difficulty doing their jobs were able to return to work or continue to work with improved performance, with sustained benefits. That sounds like a lot better odds than aducanumab, for example.
Boy, I'll tell you, that sounds too good to be true. If this treatment protocol is so good, why hasn't everyone heard about it?
Well, follow the money. In general, naturopathic medical treatments cannot be patented, so there is no possibility for a pharmaceutical company to sell the treatments at prices like aducanumab. So there's no incentive to do the placebo-controlled, double-blind, randomized studies required to get FDA approval. And without FDA approval, it is unlikely that insurance companies will pay for the treatments.
But we can offer these treatments with Patient Health and Wellness as a fee-for-service plan at rates much lower than the fancy pharmaceuticals. If you or a family member might benefit from this kind of naturopathic medical treatment, give us a call for a free 15-minute consultation. Just call our office at 928 474-7409 to schedule a free 15-minute consultation with Dr. Wyrick or myself.
Okay, yes. I'm so pumped and excited about these treatment protocols, and I will be more than happy to discuss your individual case. I do have to make a disclaimer, however. What we've been discussing today is general information and is not intended as a plan of treatment for any individual. You need to talk to a licensed physician, such as myself or Dr. Gear, in our office to guide your individual naturopathic medical treatment. Don't try this on your own. Dr. Gear, there are two related terms that I hear being used, namely cognitive decline and cognitive impairment. What's the difference?
Oh, I'm so glad you asked. Cognitive impairment is a measure of how much the brain's thinking power has been lost. Cognitive decline is part of the normal process of aging. It's a process that results in cognitive impairment. So impairment, decline, and disability and impairment, it's the same type of thing.
Subtle nuances that would appeal to English wordsmiths, but that's not our target audience.
Well, actually, this is what the Medicare and the VA and all these other entities that we have to deal with when we talk about someone who is impaired or someone who is disabled. There's a difference in the legal meaning of those two terms.
Yes, and there's a whole book just for determining what percentage a person is impaired or disabled.
Well, impairment leads to disability, but impairment doesn't necessarily make a person disabled. You know, there was a famous case of a guy who lost both hands in World War II. He had hooks for hands that would squeeze together. And he became the head of the disability department of the United States government. So he was impaired, but he was not disabled. Isn't that interesting?
Well, if he were a veteran today, he would be given probably a percentage disability, which is a whole bunch of rules that I can't go into.
Oh, there's a lot of them, yeah. So joints become stiffer, arteries harden, the brain isn't as supple as it used to be. Cognitive decline due to the aging process happens at different times and is noticed to affect different elements of people's lives. But it always has the same overall effect, increasing cognitive impairment, which simply means that your brain doesn't work as well as it used to. Cognitive decline is a response to the aging of neurons and the decreased speed at which the brain functions. Every person faces cognitive decline because every person ages.
Well, that begs the question, what causes age-related cognitive decline?
Well, the exact cause of age-related cognitive decline is not known. That's the biochemistry that's not known. Age-related cognitive decline can be the result of many different factors. As an individual ages, estrogen levels, especially in women, and testosterone levels, especially in men, will begin to decline. You know, men have estrogen and women have testosterone, but women respond more to the estrogen and men to the testosterone. So this may have little effect initially, but over time, when the threshold level is reached, it results in an awareness of a lack of energy and a decline in brain function. The lining of the arteries hardens and blood flow to the brain is more restricted. Another issue is that over time, the body builds up damage from free radicals. A lifetime of free radical damage buildup from poor food choices and the environmental toxins can cause cellular breakdown in the brain. Dr. Wyrick, would you please explain that?
Okay, yes. Uncontrolled free radical damage accumulates in the body in much the same way that our car will rust out over time. It's a similar kind of oxidative process. Having all the different antioxidants in the body can help keep free radicals under control, but we cannot eliminate free radicals entirely because they are a necessary byproduct of the activity of our mitochondria.
So what are mitochondria, Dr. Wyrick, and what do free radicals have to do with them?
Okay, mitochondria are the part of every cell in our body, and they make most of the cellular energy necessary for cells to work, for muscles to contract, for nerves to conduct, etc. An important part of the mitochondria is what is called the electron transport chain, which, by the way, needs a nutrient called CoQ10. I believe we have a caller.
Oh, hello. Yeah, this is Chris. Good afternoon, Dr. Wyrick and Dr. Gear. Good to hear you speak and talk with you again. I have two questions. I'll try to be brief. Well, actually, one comment, one question. Comment is, I'm excited that you're sharing Dr. Bredesen's work. His stuff is fascinating and, how would I say it, far advanced in terms of what most medical professionals are understanding. But I have a question. I remember talking with a psychiatrist about 20 years ago. He was Dr. Kessler was his name, not the one that was with the NIH. But anyway, and he ran a clinic at the U of A treating Alzheimer's, and at that time he was fascinated with phosphatidylcholine and phosphatidylserine as a supplement to help, along with omega-3s and so forth, as his patients. I'm wondering, is that part of the Bredesen protocol? Are you familiar with anything along those lines?
I will say that it is in my list, which is culled from Dr. Bredesen's work as well as some other sources. I don't recall whether it's part of Dr. Bredesen's protocol.
Okay, so it's still something that's of interest and worth trying, depending on the setting.
Yes.
Cool.
Depending on whatever theory would support that, and then is there evidence that this particular theoretical process is going on with this patient?
Sure. Excellent. That's my question. So you guys are having a very fascinating show, and glad to listen.
Well, thank you for calling in and giving a shout out to Dr. Bredesen.
Oh, yes. He's been fascinating. I've followed him probably for about 2-3 years, I think. Something like that, you know. The
paper I'm quoting from came out in 2014.
Oh, my. Okay. Well, I didn't know he was involved then, so I'm a more recent follower of his work.
Okay. Well, thanks again for calling.
Yeah, and I'm glad that you're broadcasting that on the radio, because so many people don't even know about him and his work and other ideas that follow from that. So I'm certainly happy that you're presenting that, and I hope that patients give it a try and come in and visit, because what you're discussing is probably the latest and greatest that we have dealing with dementia and Alzheimer's.
Well, yes in one way and no in another. Dr. Bredesen has an MD after his name, but almost every one of the interventions that he lists in his case studies is a naturopathic treatment protocol. So naturopaths have been doing this for a long time.
Yeah, my aunt started doing this, this is Dr. Gear. My aunt started doing this in 1922. That was 99 years ago. Kind of interesting, huh?
Fascinating, yes. Well, sometimes, like fashion, knowledge recycles and people pick it up, you know, or something is in vogue for a while and then it passes, other things become in vogue, and then it comes back and people realize, hey, there was something to that, right?
Oh, yeah.
Yes, there's a tremendous amount of change in medicine over the last 50 years since I started into practice 57 years ago. Tremendous change. And I'm so pleased to see it.
Absolutely. But you need to remember the old and not automatically throw it out because it's an old one. Because
right.
Sometimes the old techniques or the old understandings are truly profound.
You take the words right out of my mouth. I've been touching that ever since I started into practice when I was 22 years old.
Yes.
Okay.
Well, you continue a wonderful show, and talk to you soon. Bye.
Great. Thank you for calling in.
Okay, so we were talking about mitochondria, free radicals, and the electron transport chain. Without going into too much detail, the electron transport chain in the mitochondria acts a little bit like an automobile transmission, It harnesses the raw energy of the engine, which is revving at maybe 2,000 RPM, into turning the wheels to do the body's work. To do this, it moves electrons, but some of the electrons leak out of the electron transport chain and form what are called free radicals. Free radicals are molecules or atoms that have an extra unpaired electron that leaked out of the electron transport chain.
This extra unimpaired electron makes free radicals highly reactive and damaging to cellular structures. It's the job of antioxidants to neutralize these free radicals before they damage the mitochondria, cells, and tissues. So, Dr. Wyrick, we have a test in the office called the S3 test to look at the levels of carotenoids in the body.
Yes.
So what are some examples of antioxidants?
Okay, there are three main kinds of antioxidants. The first is in the carotenoids. These are the fat-soluble vitamins like vitamin A and carotenoids. So these antioxidants protect the fatty parts of cells.
So that's what we can kind of test for.
Yes, very simply.
Yeah, it's a very quick, easy test. Takes a minute to do.
And we don't need to draw your blood.
Stick your hand in front of a little laser, and it counts how many molecules of carotenoid are in a little area of the skin fat cells by a laser beam that does absolutely no damage to the body, and it gives a lot of information.
Yeah, it's similar to the laser beam of a pulse oximeter. So these kind of antioxidants protect the fatty parts of cells. The second kind are water-soluble, like vitamin C. These protect the aqueous or water parts of cells. And then there's a third kind that are water-soluble at one end and fat-soluble on the other. These act as go-betweens between the fatty and aqueous parts of a cell.
That reminds me of the cells that line the intestinal tract. In order to get molecules from the inside of the intestinal tract into the bloodstream, they attract them one way and push them the other way.
Yes, exchange transporters.
That's what that is. It's a push me, pull you.
Yes.
Like a magnet that has, negative on one side and positive on the other.
Except instead of a magnetic field, it's an electrical field.
Correct.
And so these act as go-betweens between the fatty and aqueous parts of a cell. But since this is not a chemistry class, I'm not going to list all the antioxidants found in our body or in our diet for that matter. But I want to mention several that are particularly important. Glutathione is considered to be the master antioxidant. And then there is the trace mineral selenium, and there's CoQ10.
I've heard a lot about CoQ10, Dr. Wyrick. What do our listeners need to know about CoQ10?
Well, four things. First, it's necessary for the electron transport chain to work. Second, it is normally made in the body by the same biochemical pathway that makes cholesterol. Third, taking statin drugs to reduce cholesterol also reduces the body's ability to make this important antioxidant called CoQ10. And finally, lack of enough CoQ10 makes more free radicals and accelerates aging.
So there are other causes of cognitive impairment besides age-related cognitive decline? Cognitive impairment can be due to traumatic brain injury, a disease, or lifestyle factors. For example, cognitive decline can be caused by elements of a person's environment that are not conducive to normal brain health. So when the body does not receive proper nutrition, it can't perform as it's supposed to. Certain elements, enzymes, etc., are required. Many studies have determined that with malnutrition, the brain becomes unable to process thoughts as effectively. It has difficulty during decision-making. Concentration becomes more difficult, and learning efficiency decreases. This decline can become permanent if general nutrition is not attended to.
Dr. Gear, you have some published studies that you want to share with us also?
Sure. The first one is called Effectiveness of Osteopathic Manipulative Medicine versus Concussion Education in Treating Student Athletes with acute concussion symptoms by Yao et al. It was published in 2020 in the Journal of American Osteopathic Association, August the 7th, 2020. So it's a relatively new study.
What? That's a lot of big words there. Concussion? Isn't that the same thing as traumatic brain injury?
According to the Center for Disease Control, a concussion is a type of traumatic brain injury, or TBI, caused by a bump, a blow, or a jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. That's like a whiplash injury. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells.
And what about dementia?
Well, according to the Center for Disease Control, dementia is not a specific disease, but it's rather a general term for the impaired ability to remember, think, or make decisions that interferes with doing everyday activities. Alzheimer's disease is the most common type of dementia. Though dementia most commonly affects older adults, it is not a part of normal aging.
And what about osteopathic manipulative medicine? Is that the same as what you do as a chiropractor?
Yes, they're very similar. However, the DO works to improve circulation, and the chiropractor stimulates nerves. They're both part of my training as a naturopathic medical and chiropractic physician. I've also had training from the Osteopathic Medical School in California in craniosacral, and both my sons are DOs.
Okay, so let's go back to the study. What did they say about it?
Well, the authors say that current treatment options that are limited and difficult to individualize, osteopathic manipulative medicine, OMM, can aid musculoskeletal restrictions that can potentially improve concussion symptoms. So as far as their objectives, more specifically, they said, to assess concussion symptom number and severity in participants with concussion who received either OMM or an educational intervention.
OMM? Osteopathic manipulative methods?
Medicine, yes.
Medicine. And how did they do the study?
Well, it was a randomized controlled study with 30 patients. It was conducted at the New York Institute of Technology, where, coincidentally, my son, retired Army Colonel Dr. Robert Gear III, DO, attended for his osteopathic medical education.
That's interesting.
So patients had concussion-like symptoms due to recent head injury within the previous 7 days. They were split randomly into two groups. One group got manipulative therapy, the other group got a concussion education intervention. Both groups were assessed before and after with a standardized tool called the Symptom Concussion Assessment Tool, 5th edition.
And what were the results of the study?
When used in the acute setting, osteopathic manipulative medicine, the manipulation group had a significant decrease in symptom number and symptom severity compared with the concussion education group. This study demonstrated that integration of osteopathic manipulative medicine using a physical examination guided individualized approach is safe and effective in the management of new onset symptoms of uncomplicated concussions. That means we have to grab a hold of a person's neck and we have to feel what's going on. We have to check out their skull and feel what's going on. We have to feel the energy fields. We have to feel the muscle contractions. We have to see the ranges of motion. And then we have to work at correcting those.
And do you often need x-rays as well?
X-rays are very helpful because we ask for them to be taken in the far range of motion of the cervical spine, and that tells us where the joints are not flexing correctly. So if you see some joints that are flexing correctly and others are not, you know where the fixations are, and that's interfering with blood flow. So musculoskeletal and nervous system injuries post-concussion result in somatic dysfunctions of the cranium and spine, which I just described, which can contribute to symptoms commonly experienced after concussion. Boy, I've seen a lot of this. I've treated more than 6,000 people injured in automobile accidents and a lot of sports injury patients. And I've seen a lot of people with the symptoms of concussion that as soon as I release the fixations and get the blood flow back into the brain, those symptoms are relieved. There's some where there's damage in the brain itself, and that takes longer to heal, and that's where your chemistry comes in, Dr. Wyrick. So OMM addresses musculoskeletal restrictions to allow for increased blood flow, increased lymphatic drainage, and decreased nerve impingements.
So what's the take-home message for our listeners after hearing about this study?
Well, I can say this about that, if I may. Borrow a phrase from one of our ex-presidents.
Yes. Was that Nixon?
Yeah, it was. Chiropractic and osteopathic medicine treatments have the potential to address a patient's concussion symptoms. Preliminary data demonstrated a significant decrease in concussion symptom number and severity with osteopathic manipulative therapy versus concussion education as screened by the Symptom Concussion Assessment Test 3, SCAT-3. Additionally, preliminary studies have demonstrated the effectiveness of osteopathic manipulative therapy in improving dizziness and imbalance in patients. Boy, I'll tell you, right now, one of my patients should be calling here because this Sunday I treated him for dizziness with a spinal manipulation because he was having a real problem. And within minutes, he started to get better. And by the next day, he was fantastically improved and said it's better than he had felt in, 8 or 9 months, because he was stumbling on steps. He was doing all kinds of problems. So,
you have another study that you can talk about?
Yeah, this one's called Association Between Sleep Duration and Cognitive Decline by Ma et al. It was published in September 21st, 2020 in the Journal of the American Medical Association. So, they wanted to answer the question, what is the association between sleep duration and cognitive decline in the general aging population?
Well, how did they do that?
Well, this was a pooled cohort study, which means they began with a randomly selected group of people who did not have cognitive decline, which in this case included 28,756 individuals living in England and China. The English participants were 50 years or older, and the Chinese participants were 45 years or older. The entire cohort is followed over time to see if rate of cognitive decline was different depending on self-reported sleep duration per night. Global cognitive Z-scores were calculated from the data.
And what were the results of the study?
They concluded an inverted U-shaped association between sleep duration and global cognitive decline was found. That means that the participants having insufficient hours per night of sleep, that means less than 4, or the same as 4, or excessive, more than 10, sleep duration experienced greater cognitive decline.
In other words, proper sleep is important for slowing down age-related cognitive decline. And that seems like a good conclusion to me. But association does not prove causation. So always that caveat with always a little bit of scientific doubt, but it sounds very compelling. And so you have another article?
Yeah, this one's short. It's an article in the Journal of the American Medical Association, JAMA, called Nearly Half of Dementia Cases Could Be Prevented or Delayed. It's written by Brigitte Kuhn, published in JAMA on September the 15th, 2020. Basically, in this article, they're covering the fact that there was a report in prestigious British journal, The Lancet, back in 2017, identifying 9 preventable risk factors for dementia. They were, and still are, having little or no education, hypertension, untreated hearing impairment, smoking, obesity, depression, physical inactivity, diabetes, and low social contact. So this article is basically an update saying the emerging evidence suggests there are 3 more preventable dementia risk factors. They are head injuries, excessive alcohol consumption in midlife, and air pollution exposure later in life. So some of the recommended steps to prevent dementia are as follows. Countries should provide primary and elementary education for all children, take steps to prevent obesity and diabetes, reduce air pollution, have programs to prevent people starting smoking, reduce secondhand smoke exposure, prevent or treat hearing loss, encourage hearing aid use and smoking cessation, prevent head injuries, maintain systolic blood pressure of 130 millimeters mercury or lower in midlife, limit alcohol to fewer than 21 servings per week, and maintain an active lifestyle. So let's explore a couple of these, Dr. Wyrick. What do you think you can do to change hypertension, high blood pressure?
Well, first of all, one of the maxims of naturopathic medicine is find and treat the cause. So there are a number of different reasons why a person can have high blood pressure. One that I'm particularly excited about is the use of biofeedback and heart rate variability treatments to lower stress response and therefore lower blood pressure.
You have that ability over at Patient Health and Wellness, don't you?
Yes, I have the equipment.
And so that could take the place of these drugs for hypertension.
In people
in some cases.
In the cases where the high blood pressure is stress related, yes.
You know, there's a problem with high blood pressure also that's related directly to the spine. The first four thoracic vertebra, that's the first four vertebrae below the neck, and all the neck vertebrae directly relate to the heart rate, and that's with the nervous system. And then the lower thoracic spine, the bottom of the rib cage area, relates to the adrenal glands, which have the hormones that affect the heart rate.
And don't forget about the vagus nerve.
Oh yes, the skull and first and second vertebra are right directly related to the vagus nerve blood flow and functioning, and so that affects it on the parasympathetic side. You know, the parasympathetic and sympathetic nervous system act like two kids on a teeter-totter, balancing each other. And if you get one of them out of balance, the other one becomes preponderant, and then your body works opposite the way it's supposed to work, and you got an on switch when you're supposed to have an off switch.
Yes, and so the sympathetic state, the fight or flight state, is the situation where the blood pressure tends to be higher than desirable.
You know, there's another thing that I'm going to mention just very briefly, and that is schizophrenia. A person who is schizophrenic can have a B vitamin deficiency, vitamin B3.
Yes, that's very well documented. The B vitamins in general are very important for mental and neural health in general. One
of the top neurosurgeons over at the St. Joseph, what's that neurology center in St. Joseph's Hospital?
Barrows?
Yeah, Barrows Neurologic Center. One of the top surgeons over there, when I asked him, what's the best treatment for brain recovery from injury? What kind of drugs have you got in the pipeline? He looked at me and he said, B vitamins.
Absolutely. And I would add omega-3s.
Absolutely. You know, nutrition, the proper nutrition for the body to repair itself is so much more effective than a drug to cover the symptom up. The only time I would use a drug to cover the symptom is temporary, to give us time to rebuild the body.
Right. If the patient is bleeding, you don't worry about him being overweight. You stop the bleeding.
Absolutely. You treat the immediate symptom in order to buy time to rebuild the body. So there's so much that we can do. Head injuries, we've talked about that. Excessive alcohol consumption uses up your B vitamins. Air pollution, well, we didn't even broach that subject. We've got ways to test to find out what kind of pollution a person has from heavy metals in their body, and then we can treat that. So it's astounding what we can do to help people not have cognitive decline in their later age, because we start in children. You know, I've got so much to tell you. I think next week we may talk a little bit about how to make expectant mothers and children healthier. I'm going to start working with some of these ladies, even more so than I have in the past. It's really nice to know that people are allowing us to help them by coming to see us. This last Sunday, I took care of 2 people in the office Sunday afternoon because they needed help. One of them had fallen backwards and bruised himself, and he's quite older and not able to do much, got bad circulation, and I gave him an adjustment. My gosh, he was so much better. This other gentleman I mentioned on the show, he was very dizzy, had lots of problems focusing, and after the adjustment, within a very short time, he didn't have those problems anymore. So it's great to be able to do these things for people. I know Dr. Wyrick and I both thoroughly enjoy helping people. That's what we're here for. Mike, thank you so very much for bringing us to the people on KMOG and allowing Doctor's House Call to be heard. And the website now has some of our old shows on it. Mike, that's a pretty good deal.
You betcha. Remember, go to KMOGcountry.com tomorrow if you want a copy of this program. And many other programs you can research and go back.
Mike, thank you very much.
All right. Good night.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.